Leader of the third party.
Thank you, Honourable Speaker. We've seen a massive erosion of public health care in our province. Ongoing staffing shortages have forced ERs across the province to close, primarily due to nursing shortages. Burnout, staff shortages, and difficult working conditions for nurses have led hospitals to rely on private, for-profit agencies to fill the gaps. Contract nursing was supposed to be a short-term solution, but this government has failed to create the working conditions needed to retain nurses who are invaluable to the well-being of our healthcare system and our province. Through you, Honourable Speaker, to the Minister of Health, when will this minister take the steps needed to not only recruit but retain nurses in the public healthcare system?
Minister of Health.
Well, thank you, Honourable Speaker. In this calendar year, up to September 15th, we've added 5,212 net new nurses in British Columbia. We've done this by improving pathways for internationally educated nurses, by training more nurses, and by supporting nurses who are working in the community. One example of that, for example, is the relational security officers that we've added on a proposal by BC nurses and healthcare workers. We said in a year we'd add 320. The year's almost over. We've added 310. Honourable Speaker, a new system for that which helps support nurses working in the healthcare system, in the public healthcare system in British Columbia, and every one of those relational security officers is an employee of a health authority.
Leader of the third party supplemental.
Thank you, Honourable Speaker. And the 5,212 is a number that the minister likes to talk about. But let's talk about some other numbers. In 2018-2019, the province spent $8.7 million annually on contract nurses. By 2021-22, the spending jumped to $64 million. Contract nurses are paid more, have better working conditions than staff nurses, making the transition to private far more appealing. Our public healthcare system is losing staff while public funds are lining the pockets of private, for-profit staffing agencies. The minister claims to be a champion for universal public healthcare, and yet under his watch, we've seen an exponential increase in public funds going to private, for-profit companies. My question is to the Minister of Health. Is corporatization of healthcare the legacy that he wants to leave to British Columbia?
Minister of Health.
Thank you very much, Honourable Speaker. Since becoming Minister of Health, we got rid of Bill 29 and 94. The Green Party called for an end to fee-for-service. We've moved from fee-for-service to a new payment model for doctors, Honourable Speaker. We've added net new in the public healthcare system, 38,000 workers in the time I've been Minister of Health. We've repatriated healthcare workers across the healthcare system. We've brought back into the system MRIs and surgical centres, Honourable Speaker. This has been an area of progress for public healthcare. And we have been dealing with a COVID-19 pandemic, for example, which did lead to an increase in the use of agency nurses. We had more to do. We didn't want to send when we were doing contact tracing and adding immunization centres. We didn't want to give up people in the public healthcare system who were also needed. But we have added to public healthcare. We've consistently done that. And yes, we're doing a record number of new projects, not one of them a P3.